Sonography is a tool that can provide valuable data regarding the location, age, and condition of the pregnancy when used properly by adequately trained personnel. Understanding the physics and instrumentation of ultrasound is essential to make the best use of this tool. The uterus and pelvis can be scanned by both the transabdominal or transvaginal route using different probes. Scanning by the transabdominal route produces a wide overview of the pelvis. Scanning by the transvaginal route produces a more detailed but narrower and shallower view. Chapter 4 includes extensive instruction in the techniques of pelvic scanning, while this chapter is devoted to the physics and instrumentation of ultrasound. Two topics are covered in this section. First, the physics of sonography are reviewed, including how physics affects sonographic images. Second, standard patient positioning and image orientation and labeling are discussed. Available ultrasound technologies are reviewed. Additional information about ultrasound technologies is included in the advanced module. The probe is the main part of the ultrasound machine. The crystals in the probe are called piezoelectric crystals. The crystals in the probe generate sound waves. The sound waves travel outward and pass through tissue and fluid and are reflected back to the probe. When the sound wave emitted from the transducer crystal strikes a reflective substance and is reflected back, the reflected sound energy strikes the crystal. Because the crystal is a piezoelectric material, it emits a tiny electrical charge when it is struck. This tiny charge indicates to the computer in the ultrasound machine the presence of objects within the ultrasound beam. By using the clock in the computer to track the time from emission of the sound wave to its return, the distance from the probe can be calculated. This method works because the speed of sound waves in human tissues is essentially constant. The construction of the ultrasound probes is highly technical. They are very expensive. In many cases, probes that are broken cannot be repaired. Care should be taken to avoid dropping them, knocking them, or running over the cord. Sound waves vary in frequency, which corresponds to pitch. Sound waves that humans can hear are in the range of 20 to 20,000 cycles per second, hertz. Ultrasonic waves are much higher in pitch and frequency, well beyond the range of human hearing. For ultrasound, frequency is measured in millions of cycles per second in units called megahertz. The frequency of probes for abdominal sonography is between 3 megahertz and 6 megahertz. Commonly, the frequency of transvaginal probes is between 5 megahertz and 10 megahertz. Frequency affects resolution, the clarity of the image. Probes set at higher frequency provide more detail. When objects are small and close together, they may be indistinguishable from one another with a low-frequency probe, while a high-frequency probe can show them as separate objects. Although higher frequency sound waves give better resolution, they cannot travel as far as lower frequency waves. High-frequency transducers, such as the vaginal probe, are useful only when they can be placed close to the object being studied. In early pregnancy, the uterus is small and the probe tip is placed close to the cervix, giving a detailed view of an early pregnancy. If a pregnancy is more advanced, a lower frequency probe, abdominal probe, allows greater depth of vision to see the whole pregnancy. Sound energy grows weaker the further it has to travel to the transducer. For this reason, deeper reflectors that are just as large as shallower reflectors will produce weaker echoes and will be seen by the ultrasound system as less intense unless there is some way to compensate. This compensation is accomplished by differentially amplifying echoes from deeper reflectors. This process is called time gain compensation and is abbreviated TGC. Ultrasound systems usually use a series of slide switches or knobs to control time gain compensation. The position of a particular switch or knob corresponds to the part of the image that it affects. Generally, the TGC switches corresponding to progressively deeper areas of the image must be positioned further to the right to create a smooth, uniform image. A TGC curve can be displayed that shows the degree to which various portions of the image are amplified. During the course of an ultrasound scan, it is common for the operator to periodically readjust the TGC switches to optimize image quality. In addition to TGC switches, a knob that controls overall gain is usually present. Although the overall gain knob lightens or darkens the image, this control is different from the brightness and contrast knobs on the video screen. The overall gain knob controls overall amplification of returning echoes. On the ultrasound shown in the photograph, the gain knobs are shown in the blue box. The depth knobs are shown in the red box. The depth of the ultrasound image can be adjusted to allow visualization of deep structures. Depth can also be adjusted to remove unused space from the bottom of the image. For structures close to the transducer, decreasing the depth effectively enlarges the view of the structures of interest. This example shows a transvaginal image of an early pregnancy. On the left, the depth has not been properly adjusted. On the right, the depth has been adjusted properly and the pregnancy is much easier to view. In addition, when depth is set correctly, detail within the gestational sac, such as the yolk sac or embryo, are seen. Sound energy is reflected from tissue. Solid tissue, for instance bone, is dense and produces a bright reflection. This brightness is called echogenic. Areas that do not produce echoes, such as fluid, are called sonolucent. This image shows an early pregnancy. The fluid in the gestational sac is sonolucent. It appears dark or black on the screen. The embryo is comprised of solid tissue and appears lighter or white on the screen. This is called echogenic. An artifact is a distortion of the image on the screen so that it may not represent the tissues beneath the probe. These artifacts are due to the physical characteristics of the sound waves and how they appear on the ultrasound machine. To some degree, artifact is present in most images. Understanding how and why artifacts are created will aid in your interpretation of ultrasound findings. Artifacts that are encountered while images are being obtained are discussed. One type of artifact is called reverberation. Reverberation artifacts are phantoms that appear on the ultrasound screen because of echoes that bounce between the probe and tissues. They are most commonly seen in fluid-filled spaces, such as the gestational sac. Care must be taken to distinguish the yolk sac from artifact. Artifacts can often be diminished by decreasing the gain. You need to freeze the moving image to take measurements and for printing an image for the medical record. Some systems store a series of previous frames in the computer's memory so that the last several seconds of images can be retrieved. It is essential to be able to perform measurements to date the pregnancy. On-screen measurements are more accurate than those performed later on printed images. The ultrasound machine has electronic calipers to use when performing on-screen measurements. The operator uses a tracking ball or other pointing device to locate and set the calipers at desired points. The software calculates and displays the measurement. Click the Measure button to set the calipers and perform a measurement of the length of the embryo in this image. If you do not get the correct measurement on the first try, click the Try Again button to try the measurement again, or click the Show Correct button to reveal the endpoints for the measurement. Imaging planes along the long axis of the body are longitudinal. The longitudinal plane that cuts the body in half lengthwise is the midline longitudinal plane. The crosswise axis of the body is called the transverse plane. Imaging planes at other angles are oblique. Ultrasound images are oriented in a standard way. This is an image of a liver ultrasound, but it demonstrates the principles of the longitudinal and transverse planes. When scanning in a longitudinal plane, the operator holds the transducer in such a way as to cause the end of the image toward the patient's head to be off the left side of the video screen, and the end of the image toward patient's feet to be off the right side. When scanning in a transverse plane, the operator holds the transducer in such a way as to cause the patient's right side to be displayed to the left side of the video screen, and the patient's left side to be displayed on the right side of the screen. This is the same as viewing the body from the foot of the examination table. In Chapter 4, we will discuss how to position the ultrasound probes and how to perform a systematic scan. Ultrasound images should be labeled with the patient's name and the date of the scan. A permanent record should be made of each ultrasound study, including an interpretation of the clinical significance of findings. A printed copy in paper medical records or permanent digital copy in electronic medical records should be part of the medical record. Documentation in the record should include name of the patient, medical record number, date of scan, name of health center where the scan was performed, name of operator, findings, i.e. number of gestational weeks, cardiac activity seen, etc. Gestational age by ultrasound is commonly indicated by menstrual weeks, for instance, 6 weeks, 3 days, or 6 3/7.